At John Knox Village in Lee's Summit, you'll find hundreds of seniors with songs in their heart and stories to tell. Like Mary Alice and her sister Pat. They've lived here for years.
She's a social butterfly. She gets all around the village. When we lived here and over in independent living, I was known as Pat's sister. You know, like somebody's wife.
Pat can't walk. She was born with a disability and lives in the village's care center.
So I want you to squeeze tight, push down, hold for a count of 5.
Home to a round-the-clock effort to give seniors the attention they need. But those costs add up.
We're feeling it, and we think that providers across the state are feeling it.
Dan Rexroth runs John Knox Village and tells me the biggest issue facing healthcare, in his opinion, is Missouri Health Net, the state's Medicaid program. State leaders cut millions in Medicaid funding last year, and right now, on average, nursing facilities get reimbursements of a little more than $150 per patient per day. That's supposed to cover everything, but it doesn't.
For the average nursing home in Missouri, the cost is $175 a day. At John Knox Village, it's about $206 a day. So you can see there's a significant gap between the funding and the actual cost of providing the care.
Caregivers are hopeful lawmakers will put what they cut back in the coffers, an issue sure to come up in this year's elections.
The fear is that providers may have to close, particularly smaller rural facilities who have a high percentage of Medicaid. There may be facility closures, particularly those smaller facilities in rural areas. We're in a crisis situation.
Now, all eyes are on November and how the state legislature handles the budget in the meantime.
I would like to pay more attention to what the needs of the people are and not the needs of the lobbyists.
Senior and nursing care are just some of the many issues facing the state's Medicaid program. Missouri, along with 17 other states, including Kansas, has an expanded coverage, and lawmakers in Washington could scale back the program on a national level as well. Cody Holnio, KMBC 9 News.